Hello everybody, my name is Sue Paterson. I'm a Royal College and European Specialist in Veterinary Dermatology, and I'm the Director of Virtual Vet Derms, which is a telemedicine company, and we aim to give vets advice in practice on difficult cases, including of course ear disease, which is what we're going to talk about today. And I'm delighted that Bayer have invited me to give you this presentation today on Neptra, which is a new and really exciting product, which I really do think is going to change the way that we manage cases in practice. Let's talk about our learning objectives today, and then hopefully we can work our way through these in the course of this presentation first of all. So what I want to do is I want to talk about the approach to an otitis case, but I just don't want to talk about how we investigate it. I just don't want to talk about how we make informed decisions on the most appropriate drugs, because those are all hugely important. But what I also want to talk about, which I actually feel is really important and possibly as important, is optimizing the experience for the dog and for the owner. I think those are really, really important factors that often get neglected in our urge to make these dogs comfortable and treat these animals effectively as we can. So what I want us to do is I want us to consider a typical client. This is Mr. Smith, and Mr. Smith is taking his dog Hercules out for a walk when he noticed that Hercules has got smelly ears. He's an attentive owner, and he's sure Hercules has never had problems before. And so, of course, the minute he gets home, like all good owners, he books an appointment at his local vet to get Hercules checked out. So what I want to talk about is I want to talk about, first of all, what client and vet expectations are in their approach to this case. And what I want to talk about is the effect of that otitis on the owner as well as the pet. And then what I also want to talk about is the effect of the veterinary experience on the owner and the pet. So what I want to do is I want to refer to this case first of all, which was published in the literature in 2016. And this is a prospective study of the effect of otitis externa, both before and after treatment on 20 owners. And it's their assessment of their own and their dog's quality of life. And this is something that we're starting to take much more notice of now, the quality of life, of how diseases affects the quality of life and how treatment can improve the quality of life. And what was really interesting is when you look at the data from that study, it shows that 85% of owners found their dog's ear disease time consuming. And of course, that by implication means if they find it time consuming, if they have a busy, active life, it may well be that compliance may be reduced if this is something that they have to take time out of their day to do. 70% found it unpleasant, and that was due to the fact that there was usually a bad odour associated with the ear disease, or sometimes, of course, we've seen it in the consulting room, the dog shakes their head and then they get discharge all over their furniture and sometimes all over themselves. And again, that again is going to make perhaps them less compliant when we're looking at treatment. And then a massive 85% of owners were also stressed or very stressed by their dog's ear disease. And we know that many owners are very close to their pets. This actually meant that many were worried that when they were giving the medication to the dog, they might be hurting the dog. And of course, if the dog backs off, if the dog shows signs of fear when the owner is medicating them, then again, this is another reason why an owner might back off and not treat the dog appropriately. And again, that causes problems with completion of the therapy, potentially, of course, things like encouraging antimicrobial resistance. So really important factors when we're considering how we manage these cases. In addition, other things that owners reported, well, they noticed that when dogs had otitis, they weren't as keen to interact with them. There was a reduction in their willingness to play. Often these dogs had difficulty settling at night. They could hear them, they were restless in their baskets. And then, of course, more worrying, they also found that dogs showed signs of aggression towards their owners when they tried to touch their ears. And worse still, where dogs had got inbuilt behavioural problems associated perhaps with previous knowledge of something, they also had aggression directed towards their owners just when they picked up the ear medication. So an indication that there were owners who actually had dogs potentially who'd had previous episodes of otitis, and they were starting to develop signs of ear phobia associated with medication applied to those ears. And of course, once we get to this stage, once we start to get an animal that becomes ear phobic, it makes it really difficult for us as veterinary surgeons to examine them, and it makes it even more challenging for the owners to actually apply medication into those dogs' ears. So another factor that leads towards a reduction in compliance when it comes to medicating these dogs.